there's a lot of talk about what health disparity looks like, and you learn it in a textbook, but being able to go out into the field and see it firsthand, but then recognizing that there are things that you can do. And so they didn't have the resources, but we were able to go and provide these resources. And it can be something as like a splint that we were able to give someone who had bad arthritis, to education, to the workers in the nursing home, and being able to educate them so they can change their body mechanics and what they do on a daily basis to ensure proper care for their patients, but to also make sure that they are taking care of themselves.
As a person coming from this experience, I am going to be more grateful for what we have in the U.S., the types of resources that we have in the U.S. And also, I think I'll look at people differently, looking at them as a person from the human side, not as a diagnosis or as a problem or an issue. So I think connecting with the person and trying to figure out their specific needs as a person and not just looking at them as a diagnosis, I think that is something that I learned from this experience.
As far as taking something away from this experience as a person, I think it's really made me grow in knowing that a lot of these patients, they just wanted somebody that they could talk to. So I might not be able to help, or even if I can't help as a physical therapist, I still need to be there as just a human, as a friend as well, and being there to be compassionate with them and just to listen to what they have to say and listen to their stories, and knowing that I can help them in that way as well as with any sort of injury or pain or any other medical situation.
Before we even got to Mexico and kind of in the beginning of the trip, we talked a lot about the health disparities that we would see. And for me, that was kind of more of the physical impairments and the diseases that we would be interacting with. But I wasn't really thinking about the disparity of health knowledge and health resources that we would encounter. A lot of the patients that we saw had a lot of systemic issues and impairments that were beyond the scope of our practice. And so for me, that was kind of surprising, and I wasn't really expecting to see people with these big systemic problems, and they had no idea that these were even a big deal because they had never been to a healthcare professional and they had never been educated on the disease process or what their impairments were.
It is in service to others that we all get to where we are because other people come before us and help us out. And I think it's really important to our society on a human level that we all help one another. And it can be that simple as helping someone cross the street to as complex going on medical service trips.
There's always going to be people that need more help than others, whether it's going to be in the United States or in Mexico. And we had a great opportunity to go to Mexico to see people who didn't have the same resources or the same lifestyle as us, and being able to help them in any way, shape, or form made me feel so much better, knowing that I can help anyone, whether it was PT related or non-PT related, that helping them, having a smile on their face at the end of the day or in the end of the treatment, and that just kind of sparks something that makes me know that I'm in the right field of being able to help a lot of other people, no matter what we're doing.